Okay, hello everyone. I hope I'm audible to everyone. Sorry for the delay. In the last few class, we have discussing posology, and we have completed posology in LM potency. Today, we have promised to go on with our next aphorisms. Aphorism number 248 completed. Both 5th edition and 6th edition have been completed. I think I have discussed 251 also in the last class. So again, let us discuss 251. I don't remember if you remember it. We have discussed this alternating action in while we were discussing drug proving also. And I hope in the last class I have discussed this aphorism number 251. Still, let's have a just go through this aphorism number 251. Okay. There are some medicines like Ignitia, Brinia, Rustox, and sometimes Belladonna. Okay, these are important for your MCQ examination where you will be asked, you will be given options, Ignitia, Brinia, Rustox, Belladonna, and one more medicines. This has been asked, this has been pattern of MCQ for Organon examination, that what have been written in Organon, what have been written here, this can be made into a MCQ. So you need to remember all these drugs which have been mentioned here, though there are many drugs which may be having alternating actions, okay, beside these, but those which have been given reference by Hahnemann have been most important for your MCQ examination as well as for your university examination, whose power of altering man's health consists chiefly in alternating actions, a kind of primary action. Symptoms that are, we have discussed already alternating action in aphorism number, I think 115 while we were discussing drug proving. So what is alternating action, what is primary action, what is secondary action, we need not to discuss here again. And what is the difference between secondary action and alternating action? One means a lump sum difference. You need to remember that secondary actions are opposite and alternating actions are also opposite, but alternating action is in paroxysm, okay, like diarrhea, constipation, again diarrhea. But in secondary action, the diarrhea, constipation, diarrhea will not return. If diarrhea is returning, this is alternating action. So this is a paroxysm of primary action, alternating with each other, okay. Alternating symptoms are different, like headache alternating with lumbago. What does this mean? Two symptoms are alternating. This is alternating symptoms. These are also important in repertory. Kent repertory, you will find many rubric having alternating with. Where you will find alternating with, you should give prime importance to those symptoms. Okay, like people will tell you that Dr. Saab, this when headache is there, I am not feeling any constipation. When constipation is there, I have no headache. Or when headache is there, lumbago, back pain is there, or when back pain is there, head pain is not there. Okay, what is this? This is alternating symptom, but cannot be an alternating action. Why? Because alternating actions are opposite in nature and paroxysmal. And why this secondary actions are not alternating action? Like diarrhea, stop, then constipation. This is one of the symptom you will get in cases of purgative. Okay. That has been discussed in previous aphorisms, I think 2-3 months back, as we are completing our secondary action, okay. And this alternating action is like diarrhea and constipation, diarrhea alternating with constipation. There are many remedies, especially soric ones, aloe and sulfur, famous for diarrhea alternating with constipation. What is this? This is an alternating action. So can you include sulfur here? For all the clinical purpose, you can say sulfur has an alternating action, but for your theoretical purpose, remember these 4 medicines which you have to give example and which will be asked in your MCQ until and unless the pattern of examination is changed. Okay. Nowadays, the examination pattern have been more focused on the text rather on clinic. Okay. Whose power of altering man's health consists chiefly in alternating action, a kind of primary action. Symptoms that are in part opposed to each other. Should the practitioner find on prescribing one of these selected on a strict homeopathic principle that no improvement follows, he will in most cases soon effect his object by giving in acute diseases even within a few hours a fresh, that is important, that is a continuation of repetition. What we have studied till now is about repetition and choice of potency. Okay, that is a continuation. What to do when your medicine is not acting? Check first whether this medicine you have given having an alternating action or not. Okay, so if this medicine alternating action, you should do what? You should repeat a fresh equally small dose of the same medicine. Okay, previously in aphorism number 247, 6th edition, Hahnemann have discussed. Remember, this 251 has no 6th edition. Okay, that will apply to the 5th and 6th as well. So in the previous aphorism number 247, Hahnemann had discussed that you should not repeat a same dose to a patient. Okay, you should give a slight higher dose to your patient every time you are giving a fresh dose. Okay, but here remember, equally small dose means same dose should be repeated in cases of medicines who are having alternating action. Okay, so this alternating action have been finished. I have we have gone through this a bit in a bit fast manner. Refer to the previous lectures where we have discussed this alternating action in detail. I think where we have discussed the their actions of the remedy, there you can see. And for those who are who need to study this in depth, okay, they need to follow Dudgeon's lecture and theory on practice and on homeopathy. But this is enough. What have been discussed in these classes have been enough, is enough for your MCQ examination, for your university examination, for your clinic purpose, even for your MD examination. But those who are doing MD in Organon of medicine, they should follow Dudgeon's lecture on theory and practice of homeopathy. So from 252 onward, what has been started? 252 onwards, the signs of improvement. Go to content and see their signs of improvement. 252 to 256. Okay, signs of improvement have been discussed. Now we were going through Stuart Close's lecture, and we have posology, and we have stopped at effect of remedy. Okay, we have stopped at effect of remedy. So what is this effect of remedy? After giving your medicine, you need to know whether your medicine is acting or not. And for this, you are having your tools like effect of remedy. What Stuart Close have discussed here. The Kent's 12 observation. You can say Kent's second prescription also. And Robert's effect. Robert's action of remedies. Okay, so these are the tools our stalwarts have collected for us to use in our clinic, and the most useful tool out of all this is Kent's 12 observation. What Kent have done? Kent has not observed himself, but rather he has compiled in an easily comprehensible manner so that we can understand. People like us can easily understand and can easily act upon this in our clinic. Okay. So Kent's 12 observation is rather a tool to examine a patient on his or her second visit. Okay, whether the medicine is acting or not, or how far the medicine is acting. Okay, so you have given medicine, three things maybe happen. Okay, what can be happen? You have given your medicine, what can be happen? Number one, no effect. Okay, patient will come and tell you that Dr. Saab kuch nahi hua. No effect. Okay, no effect has its own criteria. You have to examine 100-04. Okay, aphorism number 100-04, and here also aphorism number 254. Dr. Saab kuch nahi hua. This kuch nahi hua, you have to examine whether this means there is no effect, whether actually there is no effect, or whether patient is unwilling to accept that there is no effect, or patient is unable to tell that there is no effect, or unable to diagnose himself there is no effect, or actually there is no effect. If there is actually no effect, there may be the medicine you have given is having a alternating action. Just we have discussed 251, and what to do in that condition. You have to prescribe the medicine in same potency and same single dose. Okay, and wait and watch. This no effect. No effect has its own criteria, we will discuss. Okay, and what can happen beside this no effect? What can happen? There may be an aggravation. Okay, this aggravation also have its own criteria. What kind of aggravation it is? Okay, whether it is medicinal aggravation, whether it is disease aggravation, or whether it is homeopathic aggravation, you have to diagnose. Or there may be an amelioration. Okay, again this amelioration will have its own criteria. Whether there is amelioration as a whole, or there is an amelioration on a particular symptom you have prescribed upon, or there is an amelioration of the symptom back, the patient is not feeling relief. That observations have been of Hahnemann, that observation have been of Hippocrates also, that there is old symptoms are coming, or disease are going in wrong direction. There are many observations have been there before Kent also. What Kent have done? Kent actually have compiled all these observations in a easily comprehensible manner for us. Okay, so we'll discuss as we will go through these. So aphorism number 252. Our prime focus will be on aphorism. Then Kent's lecture we will discuss Kent's 12 observation. Aphorism number 252. Aphorism number 252. I am reading. Listen. But should we find during the employment of other medicine in chronic diseases that the best selected homeopathic, okay, no effect, we have told that no effect have its own criteria. One of the criteria for no effect is that patient have not taken medicine. We remember a case during our internship at NIH, that a patient came and told us, we used to prescribe medicine with placebo for 1 month. So the medicine happened to be in centesimal potency. 4 doses of some medicines were prescribed and followed by the PL in globules form. Okay, and the patient came and told that Dr. Babu कुछ नहीं हुआ. तो हमने पूछा क्या हुआ, क्यों नहीं हुआ कुछ? तो बोला डॉक्टर बाबू हम तो गोली वाला मेडिसिन खाए, मगर पुड़िया वाला जो मेडिसिन था वो चूहा खा गया. So what is this? Patient have not taken the medicine, so there is supposed to be no action. So you have to examine this. तो चूहा खा गया तो हमने पूछा चूहा कैसा है ये बताओ, तुम कैसे हो ये तो पता नहीं चलेगा, चूहा कैसा है बताओ. So these things will happen with you. Patient will come and tell you, डॉक्टर साहब हम नहीं आए थे क्योंकि मेरा तबीयत खराब थी. These things will happen with the homeopathic setup especially. Okay, patient will not come because पेशेंट विल नॉट कम बिकॉज पेशेंट की तबीयत खराब थी. डॉक्टर के पास कब आते हैं? जब पेशेंट की तबीयत खराब होती है. मगर होम्योपैथ के पास कब नहीं आएंगे? जब उसकी तबीयत खराब होगी. जब तबीयत ठीक होगी तो वो आएंगे. ओके, सो दीज आर थिंग द आयरनी ऑफ होम्योपैथिक प्रैक्टिस. दीज विल you will see in your cases, in your clinic. But should we find during the employment of other medicine in chronic disease that the best selected homeopathic medicine in suitable doses doesn't affect an improvement? Underline this. Doesn't affect an improvement. Underline this. Okay, this is a sure sign. What the medicine was? The best selected homeopathic in proper dose. A best selected remedy should be given in proper potency and proper dose to be acted. Otherwise, it won't have any action. Okay, best selected medicine in proper, best selected, yeah, you have to select your medicine which should be similimum or at least partial similimum to have an effect. Okay, and potency should be there. We have read in Stuart Close while going through the chapter posology that digitalis was not acting in 6 potency, in 30 potency, in 200 potency, and it has acted in crude form. Even the mother tincture was not acting and the crude form was acting because the digitalis was the correct medicine, but the potency was not resonating with the patient's susceptibility. Clear? So best selected remedy in well chosen potency, or at least partial similimum medicine with a partial resonating potency to be acted. Okay, the patient is having a low susceptibility. We have discussed in previous classes that susceptibility is high, the potency should be high. Susceptibility is low, The potency should be low, and you know the patient having lowest susceptibility possible, and you are having giving the patient 10 This is not supposed to act. A patient is having highest susceptibility and you are giving 6 potency. This is not supposed to act. And what is the method to diagnose the susceptibility? We have discussed in some previous classes that more the characteristic symptoms you are getting, the more the patient is susceptible to medicine, and the more the general the symptoms are going, that loss of appetite, or just allergic rhinitis, nothing else. Mild fever, high fever is the sign of high susceptibility. Okay, that is why during high fever or high inflammatory diseases, you need to give your medicine highest possible potency. Okay, so the symptoms will tell you. The more disturbing the symptoms to the patient, the more high the susceptibility. Or you will get some patient having abscess in the abdomen and no effect at all, no symptoms at all. What does this indicate? There is an abscess in the brain and no symptoms at all. There is just a mild fever, mild malaise, mild weight loss. These are the indication of low susceptibility. Okay, but a simple phola, a simple boil is in the hand and patient is suffering with high fever, inflammation, pain, throbbing. What is this? This is the indication of high susceptibility. Okay, so low susceptibility, high susceptibility, you need to diagnose. So potency should resonate with the patient beside the best selected medicine. And even if selected your medicine best, best possible potency, and if even then the medicine is not working, underline this, not effect and improvement. Okay, this is a sure sign that the cause that keeps up the disease still persists. Underline this. This is sure sign that the cause that keeps up the disease still persists. What it may be. This is accessory circumstances. Okay, accessory circumstances have been discussed in detail in previous classes. Please refer to previous lectures. We have discussed this during aphorism number 5. The discussion during aphorism number 5, aphorism number 208, aphorism number 94. Okay, aphorism number 94, aphorism number 18, having upterm, which is important for your MCQ examination and for your university examination. Accompanying modalities. Accessory circumstances have a new terminology for the 6th edition in aphorism number 18, accompanying modality, and how this accessory circumstance is going to affect the disease. Okay, that has been discussed in detail in previous lectures. Please refer to those lectures. Okay, in short, accessory circumstances can maintain disease, can produce disease. What is the disease produced by accessory circumstances? That is pseudo-chronic disease. And never tell your examiner pseudo-chronic disease. This is artificially named chronic disease, not original chronic disease. Okay, not natural chronic disease. And don't utter the word pseudo-chronic disease before your examination. It will irk him and will poke you that where the pseudo-chronic disease have been written, and you won't be able to answer it. Actually, pseudo-chronic disease, the term has been coined by some stalwart in some journal. Okay, and that has been popular with us because it is easy to know that pseudopodia from amoeba, false leg, that is the false disease, pseudo-chronic disease, but this is inappropriately named chronic disease. So accessory circumstances can maintain disease, can produce disease, plus can modify SORA, can modify psoric disease. Okay, that has been discussed in aphorism number 81 while we were discussing the modification of SORA, that Kangri cancer is happening in people in Kashmir because of their carrying the coal for warmth, carrying a coal in a vessel on the abdomen for warmth. This Kangri cancer is a form of advanced SORA and syphilis, but always happening in the people who are practicing this. Okay, so these accessory circumstances have pushed SORA to a particular direction. Okay, if there is a grief, the SORA will be pushed to a particular direction. If there is a stress, the SORA will be pushed to a particular direction. So modification of disease. Disease will not change. Means Sora will not change. Sora is there, but Sora have been hydra-headed, have many manifestation. These accessory circumstances can push that Sora to a different direction, depending upon accessory circumstances. That has been discussed. In short, we have told that, we have discussed here that accessory circumstances having roles to play in maintaining the disease. That is, the cause that keeps up the disease still persists. In producing the disease, what kind of disease? Artificial disease. In modification of Sora, modifying disease. Okay. And there is some circumstances in the mode of life of the patient or in the situation in which he is placed that must be removed in order that a permanent cure may ensure. Okay. That is accessory circumstance. So where accessory circumstances have been discussed, write it here. Write everywhere where there is a reference to accessory circumstances. Everywhere write 251, 252, 252, 208, 94, 7, 5, 18, and that has a special mention accompanying modalities. Now 253 starts with signs of improvement. Okay. Among the signs that in all diseases, especially in acute, such are an acute nature, inform us of a slight commencement of amelioration or aggravation. Underline this. Two things mostly happen with a medicine. Either it will ameliorate or it will aggravate. And there is a third thing, which is no effect. We have discussed that also. We will discuss that also. Amelioration or aggravation. That is not perceptible to everyone. The state of mind, underline this. The whole demeanor of the patient are most certain and instructive. Underline this. Whole demeanor. What is demeanor? The behavior of the patient. Previously, the patient was having a irritation on his face. You can diagnose few emotion on face. Anger, irritation. That is anger produced by irritation. The grief. The face will tell you that the patient is in grief. That is one photograph I have shared in the group, that a patient when first came to me having this body language. 11 o'clock, 1 o'clock. Okay, like this. This is the head is resting on the shoulder, either in 1 o'clock position or in a 11 o'clock position. This is a sign of grief. Okay. There are many body language. Body language pe kitab, Desmond Morris ki kitab I have referred in group. Desmond Morris, the naked man, naked woman, and one more book of Desmond Morris. Desmond Morris is a expert of body language. He have studied chimpanzees for years together. Means he have dedicated his life to chimpanzees and then focused to the body language of human beings. His book Chimpanzee Politics. No, it is not his book, but his one of his friends' book, Chimpanzee Politics. Okay, so these are interesting book to learn body language. Those who are interested in clinic should learn these body languages from these books. Okay, very interesting books. Chimpanzee Politics, and Naked Man, Naked Woman, Naked Ape, and one more book on body language by Desmond Morris. Okay, People Watching. These are 3-4 books. Those who are interested in clinic should read this book. Okay, so that body language was 11 o'clock, 1 o'clock. This is a sign of grief. And before telling, patient will tell you, you know that patient is having a emotional trauma in the background, and on examining, you will find that yes, your observation was correct. And after few doses of Ignitia, Ignitia is my medicine to start with patient having emotional trauma in the background. Okay, you will not go through the case until and unless you have go through this grief. This grief will obstacle every medicine to act. After a few doses of Ignitia, in the next 2-3 consultation, the head was straight. It was surprising to me. I've shared the picture in the group that this was the before condition, the patient was coming to me, and this is now the patient is coming to me. The head straight. What should be normal position of the head? It should be straight on the shoulders, lying straight on the shoulder. No, this is not a correct position for the head. Head hanging down, head hanging on side. This is a sign of emotional trauma in the background. So that demeanor have changed. Okay, and you know, even if the patient is usually ignitia patients are so polite and gentle that they will accept that yes, Dr. Babu, আপনার ওষুধের কাজ হয়েছে, the medicine have acted. So ignitia patients are gentle and polite. Usually they will tell, but even if they are not telling, by their body language you will understand that yes, my medicine selection was right and medicine have acted. By whole demeanor, the patient's head was straight now. Previously the patient was not talking eye to eye. Okay, one of the symptom for staph. And in next consultation, after giving your staph, you have seen that a patient is talking to eye. Okay, the eye contact is there. What is this? This is the change of body language. The whole demeanor will tell you that yes, the medicine has acted. The most certain and instructive. In cases of even so slight an improvement, we observe, underline this, a greater degree of comfort, increased calmness, freedom of mind and higher spirits. Okay, we have told while discussing that higher purpose of our existence. Okay, an author, a poet have enjoyed what is higher purpose of existence, our existence. We have discussed in 2-3 aspects during our discussion on higher purpose of existence. That one is the spiritual part, that to serve the mankind, to make earth a better place. This is actual our higher purpose of existence, spiritual. And other higher purpose of existence in which we find passion, in which we find joy. Okay, in which you lost the time. You cannot remember when you have started and you are finishing. When you are finishing, you have lost yourself. Okay, like I passionately see my patient. While seeing my patient, I forgot the time when it was 7 and when it is 10. Okay, so this is my higher purpose of existence. I love teaching. I forgot when it was 10 and when it is 12. This is my purpose of my passion, my higher purpose of existence. Apart from that, a spiritual higher purpose of existence. But that higher purpose of existence, when I fell sick, I don't find joy in teaching. I don't find joy in seeing my patients. Okay, so this is a sign of sickness. Patient is not enjoying his passion. Patient is not enjoying a musician don't like to take his musical instrument, and still there is no symptom. So this is a sign of sickness. Now this most certain and instructive, this freedom of mind and higher spirits. Okay, I remember when I went in second BHMS or third BHMS, I used to have writings, my diaries and poetries and essays. Okay, when I fell sick for a long period of time, for 10 or for 2 or 3 months, I remember checking my diaries and thinking that is these things have been written by me. Okay, and I told my teacher that I am finding this, that these I cannot write again. And he told me this higher purpose of existence. This is because you are sick, you are not finding your joy here. Okay, so higher spirits, people will return to his, a man will return to his passion when the medicine is correct. A kind of return of the natural state. A kind of return of the natural state. In case of even so small commencement of aggravation, underline this, we have on contrary exact opposite of this, a constrained, helpless, pitiable state of disposition of mind of the whole demeanor, and all the gesture and postures and actions which may easily perceived on close observation but cannot be described inward. Okay, cannot be described inward. Underline, whole demeanor, the gesture, the posture, action is constrained, helpless, Now footnote, the signs of epileptic disposition in mind, however, may be expected only soon after the medicine has been taken when the doses has been sufficiently minute. Okay, this will discuss, we will discuss in next class about the essential role, why the homeopathic aggravation sometimes delay the action of process of cure. Homeopathic action usually delay the process of cure. Okay, this we will discuss in next class. Up to aphorism number 253 we have discussed. We will discuss in next class aphorism number 253 footnote. Okay, then we will go to Kent's lecture, Kent's 12 lecture, 12 observation. Okay, any question you are having, you can ask. Any question you are having? Okay, no question. Very good. Thank you for giving your attention. We will meet in next class. Those who are seeing this recorded lecture can ask the question in group or can ask me directly. Okay. Thank you.